I'd started experiencing the symptoms in 2004. Around November, my body was very sore, especially when I was getting up out of bed. Like my back was like really sore. So we weren't really sure what it was. I've been exercising a lot, doing a lot of running, cardio, stuff like that, a lot of cardio. It just was not something I'd never really felt that way before. Now I've been sore and I've been wrestling, thrown around by my brothers, but this was kind of different. And it never really occurred to me that was something wrong with my skeletal system or something to do with bone marrow or anything. So that feeling never ceased, and it would kind of get worse over time. And we had went to my family physician, a general practitioner, and he diagnosed me with just having congestion, I think it was, or something, fluid behind the ears, and diagnosed me with some medicine. I can't really remember. But then we thought, and then nothing never really got better until Christmas Eve, when I was doing really particularly bad. I was kind of laying on the floor, stretched out, because the floor was cold, and it was kind of eased it a little bit. But after a while, I realized I couldn't get any really deep breaths, because a deep breath was really painful. And I'd spent a few hours on the floor like that, and then it was really getting to me. So I woke my parents up. My dad took me to the ER at our local hospital, and they did an x-ray, and they said I had soft tissue damage, which was kind of reassuring, because that was actually a diagnosis that made sense. It's like I had been working out, not prior to start, feeling bad, but before I was feeling bad. Then after that, I just stopped doing everything. So after a while, even after that, it never really got better after all the medicine and stuff. I think I had gotten a prescription of some high-end Tylenol or something like that. I can't remember what it was. But I remember toward the January, it was January 19th, is when we finally actually made the third diagnosis. But by then, I'd actually started feeling better. And I was like, all right, we're finally going to see an end to this. I wasn't particularly sore that day, but my mom noticed red dots appearing all over my skin. I didn't really think much of it. I was like, well, those don't hurt, and I don't feel that bad anymore. But then we were told that maybe we should just go and get this checked out, because it didn't look really healthy. And I think it was toward the evening when they looked at me and said, wait, we know what this is, we really don't need to wait for the labs. They knew it was pretty serious. And my parents, when we found out, I don't know if I was told I had cancer or leukemia first. If I was told, I remember watching a bunch of commercials, like leukemia awareness, cancer awareness. And I remember at a time thinking, well, I was thinking about that at one point. What was that? What is that? Does it hurt or anything? And it was one of the first things I remember when I heard the word leukemia, is those little commercials. So they told me I was pretty much like some real late stages of it, so we had to be really careful. And after that, everybody was being very polite, and we didn't really lose our heads over it. We kept a pretty good attitude, and it was actually a relief to actually get an actual diagnosis, something that was real. It's like something that made sense other than soft tissue damage, which probably would have gotten better on its own. Nope. Well, it was, I really didn't understand, because I was already feeling good, and, they said that, that they pretty much explained to me what was happening right now, that all the petechia was pretty much just blood, I guess, coming out of my veins, because they had become, because there was so few platelets in my body at the time, but there was a lot of a lot of white blood cells. And, I had heard that later, my labs that my mom had brought with me from my ER visit Christmas Eve actually showed that there was something wrong. And, they didn't really have to wait for labs to get back when she brought those with her, so we were able to react to it pretty quickly. Yeah. I wasn't really at all worried about it because I never really, because the medicine I was taking, the Gleevec, the Dasatinib and the Nilotinib, were all pretty much, you know, I wouldn't say experimental, probably experimental. I don't know, I just knew they were new drugs, so I wasn't really scared to be doing something else that was different and new. You know, and I was still alive this far, so, you know, that probably wouldn't be a big deal. And we had high hopes for it, because I was in remission at the time, after like 3 relapses, so we were on doing a maintenance therapy when I first heard that we were going to be doing this, that there was this new thing happening up in Philadelphia. So yeah, I was pretty eager to do it, you know, especially because I'll be going to Philadelphia somewhere, you know, visit somewhere, because I never really traveled before, so yeah, I was actually pretty excited about it. My mom and dad have always, you know, been pretty good about helping me and helping each other, and we had a lot of family, you know, so really taking care of things at home while my mom was up at the hospital with me, and my dad, he was actually able to get a camper onto his job site that he could stay at and be close to us, to me and my mom, whenever we were staying up at clinic, you know. And I always had my brothers would stay a few nights, and my grandparents would stay, you know. And sometimes, like during the beginning of a relapse or the beginning of a treatment, I would always be able to stay by myself for a few days before things became complicated, or, you know, like if ever I was feeling like anxiety about anything, you know. So they were always, you know, just 45 minutes away, you know, back home. So they were always able to, you know, be with me if ever I really needed them. Well, you know, we were always, you know, a real pretty loving family, you know, really, really close, you know.